Hi, I'm Dr. Cudney.
And I'm Dr. Inglesby.
And in this video, we will discuss dental implants and the potential risks of dental implant surgery.
Dental implants are titanium anchors placed in the jawbone. They serve as sturdy foundations for replacement teeth, such as crowns, bridges, or dentures. Once the implant fuses with the surrounding bone over the few months, it provides a stable support for the replacement teeth. This process of fusing to the bone is called implant integration.
Several factors can influence the success of dental implant placement. During the exam, we will evaluate the quantity and quality of bone at the implant site. If there's not enough bone, additional bone grafting procedures will be necessary. Other factors, such as infection at the planned implant site, position of adjacent teeth, implants, nerves, or sinuses, and periodontal health influence implant success. Additionally, factors such as smoking, uncontrolled diabetes, and poor oral hygiene can increase the risk of implant failure or complications. While more than 95% of implants heal without complication, sometimes an implant will fail to integrate to the bone. When this occurs, the implant may become loose, fail to support the prosthetic tooth, or require removal and replacement.
During the surgical placement of dental implants, there is a risk of damage to nearby structures, such as teeth, nerves, or the maxillary sinuses. Damage to adjacent teeth could necessitate further dental procedures, while nerve damage may result in altered sensation or pain in the affected area. Injury to the maxillary sinuses can lead to sinus problems or infections requiring additional treatment. A three-dimensional X-ray will be taken to map these structures, and the implants will be placed under real-time 3D navigation guidance to minimize your risks.
After dental implant placement, there's a risk of the loss of bone or gum tissue around the implant. This can occur due to inflammation or infection of the tissue around the implant, inadequate oral hygiene, or excessive forces on the tooth. Progressive bone or tissue loss may compromise the aesthetic appearance of the implant-supported restoration and reduce the stability of the implant over time, potentially leading to implant failure.
In cases where there's insufficient bone at the implant site, additional bone grafting procedures may be necessary before dental implant placement. Bone grafts help regenerate and augment the jawbone, providing a stable foundation for the implant and improving the long-term success of treatment. Depending on the individual's bone condition and the treatment plan, bone grafting procedures may involve using bone graft materials from either the patient's own body, human or animal donor bone, or synthetic bone substitutes.
The overall success rate for dental implant placement is high, typically ranging from 90 to 95% over a 10-year period when performed by experienced dental professionals in the proper patient selection and care. Success rates can vary depending on factors such as the location of the implant, the patient's overall health, adherence to postoperative care, and maintenance of oral hygiene. Regular dental checkup and follow-up care are essential to monitor the health of the surrounding implants and surrounding tissues, ensuring long-term stability and functionality.
Some dental implants are placed with numbing medicine alone or local anesthesia, but sometimes IV sedation is recommended. This type of anesthesia may cause disorientation, drowsiness, nausea, vomiting, or allergic reactions. As with any anesthetic, whether performed in a hospital or an outpatient setting, these risks can be serious and in rare cases may even be fatal. Your IV sedation plan is tailored to keep you safe based on your needs, desires, health, and age. Some patients may have lingering anesthetic effects, including memory and coordination issues, for an extended time after surgery. Due to these lingering effects, an escort must accompany you to the office, remain in the office during your surgery, drive you home, and stay with you until you have recovered from anesthesia. An escort must be a responsible adult that you trust and that can assist you if needed. Please be aware that if your escort is not available on the day of surgery, the surgery may be delayed, rescheduled, or completed with local anesthesia only.